Niacin's therapeutic value in cardiovascular health continues to expand beyond lipid modulation, with growing evidence highlighting its capacity to directly suppress inflammation at the cellular level. One of the most significant findings in this context is its effect on interleukin-1 beta, IL-1S, a master pro-inflammatory cytokine deeply involved in the development and progression of atherosclerosis. The study demonstrates that niacin markedly reduces IL-1S expression in lipid-stressed macrophages, positioning the nutrient as a targeted anti-inflammatory agent capable of disrupting the inflammatory feedback loops that destabilize atherosclerotic plaques. IL-1S plays a central role in the immune activation seen in atherosclerotic lesions. Produced primarily by macrophages in response to intracellular stress, cholesterol crystals, and lysosomal damage, IL-1S not only amplifies local inflammation but also promotes endothelial dysfunction, smooth muscle cell migration, and the recruitment of additional immune cells to the vascular wall. Over time, this chronic inflammatory state contributes to plaque vulnerability, increasing the risk of rupture and thrombotic events. Suppressing IL-1S is therefore a critical goal in stabilizing plaques and reducing cardiovascular risk, an approach validated by clinical trials targeting the IL-1S pathway, such as the CANTOS study. Niacin offers a unique and upstream method of achieving this. Its action begins with CD38 activation, which generates NADP, a calcium-mobilizing molecule that triggers lysosomal calcium release through TRPML1 channels. This signal then activates liver X receptor alpha, LXRA, a transcriptional regulator that enhances cholesterol efflux by increasing the expression of transporters like NPC1, ABCA1, and ABCG1. By facilitating the export of cholesterol from lysosomes and cells, niacin prevents the intracellular cholesterol accumulation that would otherwise initiate NLRP3 inflammasome activation, a key driver of IL-1S maturation and release. In macrophages exposed to oxidized LDL, niacin treatment leads to a marked reduction in IL-1S production, even in the absence of changes to systemic lipid levels. This indicates that niacin's anti-inflammatory action is locally mediated at the cellular level, where it neutralizes the intracellular stress signals that would otherwise provoke cytokine release. By targeting the source of inflammation rather than its downstream effects, niacin intervenes before damage escalates, a stark contrast to many anti-inflammatory drugs that only suppress symptoms after they have begun. This IL-1S lowering effect complements niacin's other benefits in the atherosclerotic environment. It enhances macrophage survival, reduces foam cell formation, and promotes cholesterol clearance, all of which contribute to a more stable and less inflammatory plaque phenotype. Furthermore, by reducing IL-1S, niacin may also blunt the amplification of other inflammatory pathways such as IL-6 signaling and CRP production, which are downstream of IL-1S and have their own roles in promoting cardiovascular disease. Importantly, niacin accomplishes this without the broad immunosuppression seen with pharmacological IL-1S inhibitors. Its context-dependent activation, driven by lipid stress and intracellular signaling, ensures that niacin exerts its anti-inflammatory effects selectively in diseased tissues, leaving normal immune function intact. This cell-specific precision, along with its metabolic benefits, positions niacin as a safe and multifaceted intervention for chronic vascular inflammation. In summary, the suppression of IL-1S expression by niacin reinforces its evolving role as a targeted anti-inflammatory nutrient. Rather than simply masking inflammation, niacin addresses the cellular dysfunction that triggers it, restoring lysosomal health, preventing inflammasome activation, and stabilizing immune cells in the atherosclerotic plaque. These findings solidify niacin's place not only in lipid management, but also as a strategic agent in the control of vascular inflammation and the prevention of cardiovascular events.